Bays, welcome back to another episode of VIDTOBER. If you are new to my channel, welcome. My name is Octavia. I call all of my subscribers Shay Bays, and if you want to become a new Bay, just hit that subscription button right down below, y'all. Welcome back, welcome back, welcome back. As y'all can tell by the title of this video, we are going to be talking about traditional braces and Invisalign. If you are new to my channel, I was a dental assistant for about almost 5 years, and I've been now a dental hygienist for about, I'll say almost 10 months. I also have personally had both traditional braces and Invisalign, and I feel like I've commonly got the question, being in the dental field with a lot of people wanting braces and stuff like that, you know, which is better, traditional braces or Invisalign? So I said, let me just do a video, you know, kind of breaking down the pros and cons on what I feel the pros and cons of them are. If either of y'all have had traditional braces or Invisalign, look, let me know what your thoughts are, but let's get into the video. All right, so for those who may not know, I'm pretty sure everyone does know, but just in case, traditional braces are, of course, the silver metal brackets with the wire that are not removable, that are cemented onto your teeth, and Invisalign are the clear aligner trays that you can take in and out of your teeth that are literally like custom made and molded to your teeth. Traditional braces have been out for several years, and Invisalign is more new modern technology that probably came around, I want to say definitely in the 2000s. I don't believe it was out in the 1900s. So yeah, that's kind of like a little compare and contrast. So I did kind of type some things out in my phone, because y'all, I did try to record this video and just kind of do it off the top of my head, but yeah, I said, you know what, Octavia, just put it in your phone and go from there. So what I put as my pros for traditional braces, which wasn't many, were they were non-removable. I say that's a pro because with it not being removable, you have less chance of you losing your tray, having to pay another fee for another tray, prolonging your treatment because now you have to wait on another tray and things of that nature. Yes, it's possible for you to lose a bracket, but in that case, oftentimes you can call your office, go in, and they can put your bracket on the same day if you're available, or that same week, versus you having to wait like 2 weeks to a month, however long it takes for them to get you that new aligner tray, depending on when you break it. I said change colors. I feel like that's a fun part of having braces. You getting to pick the different colors that you want. Like I had purple, I had blue, I had red, I had green, I had pink. Like I enjoyed changing colors. And yes, I had braces at the big age of 22, 23. So yeah, I like changing my color of my braces. I know some people don't like traditional braces just because they don't like the colors. They think it's kitty, or they don't like the look of metal in their mouth. But I think for that, it's personal preference. It's definitely not cosmetic when they're on, but when they're off, if you're taking good care of your teeth, baby, the teeth be teethin', okay? Now, here are the cons of traditional braces. So, one big con for traditional braces is oral hygiene. Y'all, it is so hard and frustrating flossing braces, because you have a wire that you have to get underneath or get over in order to get down and really be able to floss those contacts between your teeth. Water flossers are good, but traditional floss is the best if you really want to get down below that gum line. I know there's a lot of controversy or different opinions on whether you should use a water flosser or traditional floss. I tell my patients I recommend traditional floss, but you can use both. You can interchange the tooth, but I wouldn't solely recommend using a water flosser, just because I don't feel like it really shoots all of the plaque ends harder from between your teeth below your gum line. That's just my opinion. Yeah. Also, brushing that bracket, that wire, also enables the toothbrush to actually be able to really clean all the surfaces around that bracket of your tooth. So you really need to honestly use a toothbrush and also like a little proxy brush to really be able to get under that wire and clean your teeth. So probably without braces, it takes roughly about 2 to 5 minutes to do your full hygiene routine. I would say with traditional braces, take that time up to maybe 5 to maybe 10 minutes, because it's going to take time to really thoroughly clean everything. And baby, braces trap everything you eat. Every time you eat something, it's going to be food stuck in your teeth. Like, it's inevitable. It doesn't matter what you eat, something's going to get stuck in there somewhere. Another con for braces is eating restrictions. You can't eat everything you want to eat, because crunchy stuff, sticky stuff, anything like that can easily pop off your bracket or pop your wire out. And if that happens, like I said previously, you need to go back to your appointment and get that re-cemented on. Now, I will say that depending on how many times it happens, some offices may charge you for replacing that bracket if you've lost the bracket, or sometimes they may not. It just kind of depends on the office policies. Everywhere is different. Also, another con is frequent dental visits. So with traditional braces, depending on what stage you're in, you're going to be going to your dental appointment, I'm going to say about every 4 to 8 months. So you're essentially going to the dentist every single month. And I know people do not like the dentist. Every time I get a patient, they tell me, I don't like y'all. And that's fine. I understand. It is okay. So that may be a con for, sorry, I'm getting a phone call. That may be a con for many reasons. For many people, depending on your schedule. So yeah, but hold on, y'all. Let me answer this phone call and I'll get into the pros of Invisalign. All right. So now to Invisalign. So some of my pros to Invisalign is the fact that it is removable. You can take it in and out. You don't have to keep nothing uncomfortable. Well, let me rephrase. You do have to wear it. You should wear it for at least 23 hours out the day. Well, because you want to take it out to eat. You should keep it in throughout the day. When you're drinking, it's fine. Just only taking it out when you're eating and brushing your teeth. Those are the only times you're supposed to take out your trays. So I would definitely say that is a pro, that you can take in and out. Being able to take it in and out when you brush, it does make it easier for you to have better hygiene. You're able to brush your teeth as regular, floss them regular. You don't have to fight no wires, nothing like that. The little buttons that you do have cemented on your teeth that the tray essentially attaches to, that controls the movement of your teeth, that doesn't affect you brushing your teeth at all or anything like that. With Invisalign, also another pro, depending on your office, is less dental visits and quicker appointments. So some offices will give patients all of their trays at one time and just say, hey, when you're done with these trays, come back. And so essentially you don't have to go back to them for 6 months, however. Or some offices may give you 3 months of supply of your trays, because with Invisalign you're changing your trays every 2 weeks, I believe, if I remember correctly. I'm gonna say 2 to 4 weeks, because I think that's how often I change my trays. So you're changing those out that frequently. Once you're done, typically you come back in, they check, and then you get your next set of trays. But if your office has you come back in for every time you do a tray adjustment, then that appointment is really like easy peasy. Like all you're doing literally is giving them your old tray and popping your new tray in, and that's it. You don't have to sit there, get a wire taken off, get new wires put back on. None of that. You just literally dropping off, picking up. Another pro is you can eat whatever you want, baby. If you want to eat a Jolly Rancher, eat a Jolly Rancher. If you want to chew some gum, chew some gum. But the con to that pro is you will have to be taking your trays out. So if you are a snacker who likes to snack frequently throughout the day, baby, you are about to get put on a diet, because their frequent stacking will not be beneficial to you with your trays, because you need to wear your trays for the longest amount of hours per day. And of course you cannot eat with them on, even though I've come across a patient who was eating with their trays on, and no, don't do that, because you will definitely break those trays, and breaking the trays is not good. All right, so now that I'm done with the pros that I had, so here were my cons to Invisalign. With you taking your trays in and out, it is very important for you to keep up with your tray case so you can put your trays in, because you can lose your trays. And if you lose your tray, depending on when you lost that tray, sometimes you may have to get another tray made, and it could prolong your treatment. And you may have to pay a fee to get that tray made. So that is a con to Invisalign, losing those trays and having to possibly get another tray made. Sometimes it may be fine. They be like, you can just go ahead and skip to the next tray. But baby, your teeth probably gonna be hurt. But we'll get to that part a little bit later on in the video. Another con is cost. Invisalign can be a little bit more expensive to traditional braces, just because with Invisalign the trays are fabricated at a lab, so you do come across having to pay that lab fee. But like I said, cost just kind of depends on your office and also the time of your treatment. Sometimes Invisalign can be cheaper than traditional braces. It just all depends on how long you need them and things of that nature. Also, another con for Invisalign is once you're done with all of your initial treatment, sometimes your teeth may not be where you want them to be, and you may have to go through another set of trays. So say for example, your dentist or orthodontist says, oh, you only need trays for 6 months. You completed the 6 months of those trays, but your teeth aren't where you desire them to be, or are not in where you guys planned them to be. You may have to do a refinement and be in Invisalign for 6 more months. Versus with traditional braces, you can see, well, you can see how your teeth are moving with both, but the dentist can, or orthodontist can better control that movement and still keep you on track to hopefully finish your braces in that 6 month to 2 year, whatever time frame that they gave you for your braces. So yeah, those are my pros and cons for Invisalign and traditional braces. But I will tell anyone who is debating on them both, you know, or thinking about getting any type of orthodontic treatment in general, a lot of people were nervous about braces because they say, oh, it hurts. The same discomfort you have with traditional braces, you have that same discomfort with Invisalign. Your teeth are moving, so no matter what way they're moving, you're gonna have some soreness or discomfort. Every time you change a tray, it's like going for your adjustment at the dental office. Your teeth are gonna be sore for about that 1 to 2 days after your adjustment or after you change your tray, but then once your teeth start to move and settle in, you're not sore anymore until, of course, you change your tray again or do your adjustment again. The soreness, honestly, are about the same for both. I will say though, for traditional braces, I guess because that was my first time ever having any orthodontics or whatever, when I first got them put on, like my first day, I was sore for about a week. Like, it took time for my teeth to settle, but after like that first week, when I would go for my adjustment, my soreness was only for about 1 to 2 days. It wasn't unbearable. I could deal with it. So yeah. I also will say for both traditional braces and Invisalign, you can get more gum inflammation just because things are moving. So with that pressure of your teeth moving, it can cause your gums to become irritated and swollen and inflamed. So that's normal. That can happen with traditional braces or Invisalign. It also definitely depends on how well you are keeping up with your oral hygiene. So making sure that you are brushing, flossing, all that you can to keep your teeth as clean as possible, to kind of help reduce that inflammation. But gum inflammation is definitely a side effect, I would say, of having any type of orthodontic appliance. So yeah, when it comes to making that decision on whether you should do Invisalign or traditional braces, I always ask the question, you know, are you responsible? Do you keep up with things? Are you going to be disciplined to when you take the tray out to put it back in? And a lot of times people are honest with themselves and say, no, I'm not going to be able to do that, so I need to do traditional braces. I may not like it, but this may be better for me because I know I'm not going to have the discipline to take that out. And that's fine. You should know yourself. At the end of the day, you are paying for it and you do not want to waste your investments, okay? Also, with getting orthodontics, once you get your braces off or you're done with Invisalign, please get a retainer and wear your retainer, because if you don't, your teeth are going to move back to their original position or just move in general. They will not hold their place, because teeth are always moving and you have to think you just moved them out of their natural position. So of course they're going to move back to what is comfortable or the position that they originally were in. They're not going to stay the same way. And we also have a tongue in our mouth that is very strong, that sometimes likes to push up against our teeth and causes movement as well. So I've also heard patients say, oh, I didn't know I should wear a retainer, or I didn't know how long I should wear it. Wear your retainer. When you first get them off, you should be wearing them throughout the day, like Invisalign, whether you get the clear retainers or the Harley retainers, which is like the metal wire retainers. You need to wear them day and night, at least, I would say at least for the first 3 to 6 months, and then from there you just sleep in them every night just to keep them in place. Because trust me, no matter how long it's been since you've had your braces off, if you start becoming inconsistent with wearing your retainer, you are gonna feel it. You take that retainer out and don't wear it for 3 days, a week, you try to put it back in, oh my gosh, the soreness is unbearable. And I'm telling you, I'm knowing from experience, because when I'm sick, I don't put my retainer in. That's just me, a personal preference, just because I feel like I'm putting the sick germs back in my mouth. So for the period that I'm sick, for that week or whatever, I don't wear my retainer. So when I do go to put my retainer in after I'm done being sick, yeah, it feels like I'm literally ripping my teeth out. So with that being said, make sure you wear your retainer consistently if you want to keep your investment, which is your straight teeth. Okay, you have to maintain. But anywho, that is gonna be the end of this video. Like I said, if any of you guys have ever had traditional braces or Invisalign or both, comment down below and let me know which one you prefer. If you have traditional braces, what do you like or don't like about it? And if you have Invisalign, what do you like and don't like about it? So yeah, let's chat down in the comments. And if you have any other questions or concerns or want me to do any other videos, just let me know and I may, you know, conjure up something for y'all. But anywho, I hope you guys enjoyed. Make sure that you like, comment, and subscribe, and I'll see y'all in the next one. Bye, babes.